You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
My name is Dr. Odong Olwejo. I'm the Senior Executive Consultant of Yumbe Regional Referral Hospital. Yumbe Regional Referral Hospital is a new regional referral hospital in West Nile. The other regional referral hospital is Arua Regional Referral Hospital. This hospital was opened on the 1st of July 2021. It was inaugurated by His Excellency the President of the Republic of Uganda, General Yoweri Kaguta Museveni, on the 1st of January 2021. Ever since this hospital was opened, it served the district of Koboko, Yumbe, Obongi, Moyo, and Ajumani. It serves a population of about 2.4 million people. Of this, we have about 635,000 people. Of these are refugees, and the refugees from the Republic of South Sudan and the Democratic Republic of Congo. We also have refugees who walk in and out through the porous borders, and they come for services in this hospital. Ever since this hospital opened, the services have expanded from the outpatients department to the various specialties. We now have services of obstetrics and gynecology, surgery, medicine, pediatrics, and child health. We also have other services which have come in, which is ophthalmology, as well as orthopedic surgery. There are also operations in other subspecialties where we have the orthopedics, we have occupational therapy, as well as mental health, and the other services we offer for investigations like radiology, like the lab, which we offer to our patients. This hospital, ever since it opened, we had challenges of staff. First and foremost, we had the team from the Health Service Commission who came here and validated our staff. There were staffs who were validated and taken in, although there were others who fell off because of one reason or the other. Either they didn't have practicing licenses or they opted to remain in the district. Now, from then up to now, the government of Uganda, the Ministry of Finance, Public Service, and Health Service Commission interviewed more staff, and we got more staff, so that as we speak now, we have consultants, associate consultants, we have more medical officers, we have nurses and midwives, and these people are offering services in the different disciplines. We continue to offer the best for the patients we see in our hospital. As we speak now, we have now operationalized the private wing, which was not operational last year. We have also got the opportunity now to have this facility as an internship training center. We have now got interns who have come here to do internship in medicine, those who have come to do internship in nursing, those who have come to do internship in midwifery, as well as in pharmacy. We continue to supervise the health facilities in our catchment area. That is the general hospitals, the health center 4s, and health center 3s. We do support supervision, we do mentorship, as well as training. And when we get a facility which is not doing well, as per the reports, for example, if there are maternal death, there are infant death, the team from the regional referral hospital go to these facilities to investigate and also mentor those at those lower levels. We have also now formed the Yumbe maternity system, where we have a weekly meeting to review what takes place in our catchment area. The referral systems have improved. The phones and we place phones in the wards. When a patient is being referred, information is sent prior to that, and by the time the patient reaches us in the hospital, we are really ready to handle that patient. We also have challenges. First and foremost, we thank the government of Uganda, that is the Ministry of Health, the Ministry of Public Service, the Ministry of Finance Planning and Economic Development, the Health Service Commission. For so far, the staffs they have recruited for us, because this has already reduced on the workload. The over 75 staff who have been recruited to treat the patients for us are doing a great deal. However, we still have challenges when you come to this hospital. We have challenges in some of the departments which are not yet functional. For example, the mental health, we still don't have a unit. The ENT is not yet there. The blood bank, the advanced imaging center are not yet in place. So these departments also need to be constructed. We still have a challenge of human resource. Although we have got consultants and associate consultants, we still need more. We still need more doctors, we still need more nurses, more midwives, as well as the other cadres. In the area of funding, we also need more funds. The funds we are getting are not yet enough. As a new regional referral hospital, we need a little bit more. Being a baby, we need a little bit more compared to the other established health facilities. Yumbe, being the farthest regional referral hospital from Kampala, needs a little bit more funding. We also have a challenge of land. The land we are sitting on as a regional referral hospital is the same land area of a general hospital. The other day we had the UPDF brigade when they came to construct for us the oxygen plant. We really struggled to find a space where to fit it in. So we need to be supported, and more land needs to be bought for this facility. We also need more equipment. We need more challenge of power. Our power goes on and off, and when we use the generator, it's very costly for us. We also need other support in the area of equipment, medicines, and the like. There are patients who are willing to pay and want to get specialized services quickly. We have introduced the private wing where people can pay a little bit for the services they need. So this is run on a business model. Some bit of money and you get the services you want. So patients who can pay, please do come and you'll get the services. You have the consultant, you will have the care you will need. We have the general services where you get general purpose services as well as the other grades. We have rooms, and the rooms also have different grades. There is the platinum, there is the gold and silver. Thank you very much.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Good evening, viewers. You are welcome to UBC TV. This is the DOCtalk show, which is brought to you by Ministry of Health of Uganda. We are here for this session at Yumbe Regional Referral Hospital. I want to first take this opportunity to wish you a happy Lent period and also Ramadan to the Muslims. I'll take this opportunity to say Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mukama Hamuza. I'm a medical officer at Yumbe Regional Referral Hospital. I also want to introduce the people I'm going to work with.
Thank you so much. Good evening, my viewers. My name is Letio Susan, a midwife working here in Yumbe Regional Referral Hospital. I work particularly in maternal child health department. Thank you.
Yes, good evening, everyone. I'm called Dr. Inzama Wilfre, consultant obstetrician and gynecologist. I'm the head of department Obstetrics and Gyn, Yumbe Regional Referral Hospital.
Yeah, thank you so much, doctor and sister, for sparing time to speak to the Ugandans about health. So today, we shall be speaking about safe birth awareness campaign. As you are aware that March is a month of safe birth awareness. So we shall take this opportunity to invite Dr. Inzama to tell us about safe birth awareness. So what is this safe birth awareness that we are talking about today?
Thank you, moderator. Safe Birth Awareness Campaign is a special package by the Ministry of Health and which is being implemented in the month of March to raise specifically awareness about antenatal care, delivery, and postnatal care. This is on the background that we still have high maternal mortality rates. We still have low attendance of antenatal care. So Ministry of Health thought it wise if we make awareness during this period of March, that will increase the number of pregnant women coming to seek care and have better health outcomes than when they are not aware of the services which will be offered during this period. Safe Awareness Campaign, what are the aims? The aims are, one is to promote safe delivery practices. Safe delivery practices means that we should be able to provide the same type of care for a woman who is at a regional referral or national referral hospital, same level as the one who is going to receive care from a district hospital, level 3, and then also level 2. Number 2 is that we also want during this time to reflect on the best practices. That is looking at our indicators improving. Did we do well during the previous year? Then number 3 is to raise awareness. We still have more pregnant women who deliver at home. So we want to make them aware that there are better services which are offered at what? At health facilities. Number 4 is to improve care for the mothers, which goes hand in hand with the previous topic I've already talked about. So during this period, there are key activities which we do, which includes education. Education is basically creating awareness that there are these services which are being offered. Government has brought services closer, so you should come and have these services. Number 2 is to equip our facilities such that when they come and in case they develop complications, then they should be able to be handled well, or even if they develop complications, they should be in position to be referred to a higher center. Number 3 is to engage the community, give them feedback through community dialogues. So how is this campaign implemented? It's implemented through TV talk shows like this. It's implemented through outreach programs. It is implemented through radio talk shows. The aim is to use impactful interventions, but they should be low cost. And most of these should be integrated into the existing primary healthcare services. And on top of those methods of delivery of these services, what are those 5 safes of safe birth awareness campaign? It involves 1, the facilities should be safe for these mothers to come and deliver. That is clean environment, clean delivery beds, clean equipment, and then also you should be prepared. That is, have safe hands. You should deliver a mother when you have washed your hands. At the same time, put on gloves, put on gumboots such that blood doesn't splash on you when you are delivering these services. The other S is, it's about safe delivery. We should have a skilled birth attendant, at least 2 of them. If there's only 1, then you need a client's attendant to be around, such that in case a complication develops, you should be able to inform the next health workers within. Then the 4th one is, in case a complication occurs, she is unable to deliver, we should be able to offer safe anesthesia. Safe anesthesia means when you are going to operate her, she should not be able to feel any pain during delivery. Then number 5 is, we know mothers deliver from level 3, level 4, level 5, level 6, level 7.
Okay.
In case you are not able to offer services at level 3,
Yeah.
if a mother develops a complication, the labor has taken long,
Yeah.
then she should be referred safely to a higher center for a service which cannot be offered at level what? Level where she is currently.
Okay, thank you so much, Doctor, for enlightening to the community and the viewers of UBC about the aims of the safe birth awareness. And we have seen that these are some of the things that are affecting our mothers, our sisters, our children who are giving birth every day, as Doctor has enlightened. He has talked about what this entails, what is it about. He has also told us about the aims of safe birth awareness campaign, as we have already said. I want to also take this opportunity to invite Sister Susan to tell us more about the safe birth awareness, in particular about Yumbe sub-region and the Yumbe Regional Referral Hospital. You're most welcome, Sister.
Thank you so much, moderator. First and foremost, I would like to acknowledge the UBC team for coming up to Yumbe. You know, Yumbe is a hard to reach area, hard to work,
Okay.
and it's very far. Now, on top of what the doctor has been explaining about safe birth awareness campaign, I would like to throw more lights on teenage pregnancy. When you look at Yumbe as a whole, we have a high rate of teenage pregnancy. So the teenage pregnancy actually stands at 20%, which is against the national target of 15%. So we still have challenges with the safe birth among the young people, especially the adolescents, 15 to 19. So they encounter a lot of difficulties during birth. So we actually working hard hand in hand to see that they are safe, so that we reduce maternal mortality and morbidity, which is very common in young women. Yeah, thank you so much.
Thank you, Sister Susan, for that addition, especially stressing the issue of the young children, the young girls getting pregnant in this Yumbe sub-region. I want to take this opportunity to thank you for sticking to UBC TV, and this will be the end of our first session. We are going for a short commercial break. Thank you.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying, and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
This message is from the Ministry of Health with support from partners.
Welcome back to the DOCtalk show. This is UBC TV that you are watching this evening. We're still talking about the Safe Birth Awareness Campaign. And for now, we are going to talk about the different components of this Safe Birth Awareness Campaign. So, Dr. Inzama, what are the components of this Safe Birth Awareness
Thank
campaign?
you, moderator. The Safe Birth Awareness Campaign has 7 components,
Okay.
which we are going to elaborate about, such that our viewers will be aware of.
Okay.
And so number 1 is what we call preconceptual care and planning.
Okay.
Preconceptual care refers to care provided to a couple which wants to get what?
Pregnant. Okay.
So it is generally care provided before pregnancy.
Okay.
And provided before pregnancy, and what are the components within the first component?
Okay.
It involves, first of all, making the couples aware and also educating them about fertility.
Okay.
Fertility refers to, most of our clients, they come to the hospital and some of their complaints would be like, I've failed to what?
To conceive.
To conceive.
Yeah.
So we don't really want couples to come when they have already faced a challenge.
Okay.
They should come before they try it.
Okay.
So during that period of awareness, we make them aware of what is fertility exactly.
Okay.
How do you how do you get to know that you are ready to conceive?
Okay.
Assuming your husband stays a distance or your wife stays a distance. So the timing bit is very important.
Okay.
And then it also gives you time to prepare, and also at the same time, if you are not ready, you can still take up a birth control method.
Okay.
Yes, you can take a birth control method.
Yeah, in our community here, people think that infertility only affects the women. But so does it also affect the men, the infertility you are talking about in this preconception care?
Yes, it also affects. A good percentage is the women.
Okay.
Then some percentage is by it's men.
Okay.
Then another percentage is both.
Okay.
So people should be aware. But in our communities, we always tend to blame the woman for infertility, not knowing at times it is the man or both of them have have a problem.
Okay.
Yes. So we need to make them aware of those.
Okay.
And then also during that time, if they don't want to conceive, they can choose a better method for spacing and when they are ready to conceive.
Okay.
Then number 2, in terms of preconceptual care and planning, is we look at, we do health assessment.
Okay.
That is, we want to find your suitability in order to conceive, then at the same time to carry the pregnancy to term.
Okay.
So during this period, there are those who may be having other diseases, like maybe somebody has high blood pressure.
Okay.
Somebody has a diabetes, which we call it sukari, locally in our setting here.
Yeah.
And then we also want to look backwards in the family. Is there any problem which can affect their fertility potential? That is ability to conceive and then carry pregnancy to term.
Okay.
Yes. And then we also want to find out exactly what are some of the drugs which they are taking. Because there are some drugs, they affect, first of all, your ability to conceive. Then at the same time, the ability to carry the baby to term.
Okay.
Then also at times they interfere with the growth of the baby, such that the babies develop abnormal structures on the body.
Yeah, we have seen babies that have big heads, some babies that have holes at the back, some are having deformities of the legs. So it is very key to come for this preconception planning.
Yes.
Okay.
And then the other thing which we take the clients through during preconceptual care is about their nutrition and lifestyle.
Okay.
People are not all the same. Some of them take other things like alcohol, or they take other substances. In our setting here, Yumbe and then West Nile, there's a lot of consumption of marijuana, which in one way or the other may affect. So during preconceptual counseling, we encourage them to at least stop all that.
Okay.
Then also, there are those who will come and then they may have low weight.
Okay.
There are those who will come, they have low blood levels. So we encourage them to first give them time and ensure that they gain the right weight in order to carry the pregnancy. Then also during this period of preconceptual care, we also give them additional medicines, or what we call them as supplements.
Okay.
Such that at least they should take it for a period of 3 months. And this will help the baby not to develop abnormalities like which you have mentioned. Babies born with the big heads, or babies born with swelling at the back, what we call spina bifida. Or you find babies now commonly, they are delivered, but their intestines come out. There is no cover on the abdomen, so they are delivered and then the intestines are out, what we call you call it what?
Gastroschisis and
yes.
Yes.
So we give them those supplements.
Okay.
And then if you are taking other medicines, you should especially those who are epileptic. Epileptic means that there are certain drugs, if they keep taking while they are pregnant, then most likely it will affect their baby during pregnancy. So we give them information about all that, and then they make proper choices in order to make pregnancy safe and successful.
Okay. You know, some people in our community have a thinking that when your baby is born with an abnormality, maybe it is witchcraft, maybe your in-laws are not liking the baby. You know, those are some of the things that the community have. So they have to be aware, as doctor has said, that some of these drugs like folic acid, as he has said, can prevent some of these abnormalities. Doctor, there's that issue you spoke about, alcohol. When should someone stop taking alcohol, just in case they want to conceive? For how long should they stop the alcohol maybe? Or at what period should they not touch the glass at all?
Thank you, moderator. Actually, you should stop taking alcohol for at least a period of 3 to 6 months.
Okay.
You should stop taking it. But again, taking alcohol during pregnancy also worsens the whole situation. So ideally, you should not consume alcohol if you intend to get if you intend to get pregnant.
Okay.
Yes. And then also, the folic acid is very important in the sense that if you are a pregnant woman in the previous pregnancy, you delivered a child, and the child has maybe big head or swelling on the back, there is normally a higher chance that the same condition may occur in the next pregnancy. So even during preconceptual care, we take detailed history to find about your previous pregnancies and the outcomes.
Okay. Yeah. Thank you so much, Doctor, for enabling our viewers to understand the different components of safe birth campaign. Sister Susan, I would like you to tell us about quality antenatal. What should a viewer who is watching UBC right now, I want them to understand, what is this antenatal? What are these different components? What timing? When do we start this antenatal period? Thank
you so much, moderator. This is the second quality antenatal care. First of all, I would like my viewer to understand what is antenatal care. Antenatal care is a care provided to pregnant women throughout their pregnancy.
Okay.
And also through their pregnancy, and this aim to ensure the health and the well-being of the mother and the fetus, which is developing in the womb.
Okay.
So it is really key time for a woman to confirm that if she really misses her menstrual period, she really needs to come to the hospital to confirm whether she's pregnant or it's something else. Because you can miss a period and it can be something else, maybe disease or another thing.
Okay.
So it is very important for them to come and confirm the pregnancy. That's why the services of antenatal care is there for the women.
Okay.
And then when we look at the packages, the package services that we provide during antenatal, we look at when this mother actually comes She has the first contact with the midwife.
Okay.
Because midwife is a key to this mother. So the midwife will have some discussion with her through history taking, then followed by irregular checkup.
Okay.
For example, we request for the urine.
Okay.
We use HCG, that is a test where the test can confirm that this woman is pregnant.
Okay. I want to go for a short commercial break. We are going to be back soon.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Out. You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back. This is the DOCtalk show at UBC TV, brought to you by Ministry of Health with support from the government of Uganda. So, Sister Susan, we're still talking about the different packages in antenatal care that are offered in Yumbe Regional Referral and possibly the other supervised facilities around the 5 districts. So what are some of those packages, possibly if you could highlight them again for our viewers?
Thank you, moderator. I'm continuing with the quality of antenatal care. As I mentioned earlier, one is a regular checkup where you look at the BP, then there's the health assessment, proper history taking, and then also laboratory tests. For example, we have triple testing where we test for HIV, syphilis, and hepatitis B for all the pregnant women. Then also we test the HB level. We need to see the level of blood in this woman, whether it is low or it is sustainable. And then we also counsel them about nutritional. They should eat balanced diet food that give them the growth and proper development of the fetus and the well-being of the mother. Then also we offer them vaccination, that is preventive services, like we give them tetanus toxoid, and also deworming and vitamins, and also other supplements. And also we help educating them on how to make pregnancy safe. Then concerning the issue of timing, we are actually implementing Ministry of Health guideline of goal-oriented antenatal care, whereby a woman has to attend 8 visits.
8 visits?
Yeah, 8 visits. In first trimester, that is actually from any time a woman confirms that she has missed her period, up to 12 weeks. In our local language, we said, idrimba echera, le memu daktariga. So from 0 to 12 weeks, you come and they confirm the pregnancy, and with the many other screening which will be done at antenatal care. Then the second trimester, second trimester start from 13 weeks up to 28 weeks, where we also discuss about the present complaint. You know, there's a lot of issues where the woman goes through, like morning sickness, not feeling well, the danger signs. They are all discussed about this, and also male involvement in this. Then the third trimester, it starts from 29 weeks up to 40 weeks. That is a key period where we discuss about the danger signs, we discuss about birth preparedness, how far have you prepared for this coming baby, because this baby needs something to be prepared for.
Sister, there is some point you have stressed about the male involvement. I want you to flow more light and possibly stress this point. You know, sometimes the male are not involved in the antenatal care of their women, of their wives. For them, they are saying, I will be in the center and just wait to go and receive the baby. So I would like you to flow more light on that point. how are we doing to involve men in this antenatal care services of the mothers?
Thank you so much, moderator. Actually, this is a very good topic. In fact, it is actually small even for this time to explain about male involvement. Actually, when you see the statistic in Uganda, you may find about around 10% of men who attends antenatal care. And mostly it is the woman who takes the burden of this pregnancy. But I would like to urge the men out there, you need to be proud of your woman. When your woman conceives, accompany her. You know that one give her happiness. And she feels really, we are together in this fight. So that is also one of it. Then also emotional support. You know, as a woman, when you conceive, there are very many challenging issues which goes around you. So you really need more support of your husband than any other person. So emotional support to this woman really helps her to build up and become active with everything. Then also you need to provide what is needed for her, like a balanced diet. Don't leave this woman alone. You need to serve this woman, give her what she wants. Because during pregnancy, you may find sometimes the fetus inside you will refuse everything for you to eat. But it will differentiate you from eating something which is not even there, but it has to be to look for it to eat. So that one also help the men to really accompany their women. And it's also another thing is when you come to the facility, they test you together for HIV. You may realize that this woman will say, we are all safe, and our baby will be safe. But mostly you may find men dodge to come and test because they have a lot of corner, you know, side dishes, whatever there. But I encourage them, actually, they should come and accompany their women. So that's why quality antenatal care need both of them to bring a quality family, a healthy family, and a healthy community.
Thank you so much, sister. Dr. Inzama, are there some other components that we still need to explain? More light, especially on the scan. We have seen people who go for antenatal care, they go for scan. If they are to go for scan, when should they do the scan and how many times? Or is it part of the obstetric assessment? And are all those services available in Yumbe Regional Referral Hospital?
Thank you, moderator. It's very important to do an obstetric scan, and that helps the doctors, the nurses, the midwives to plan for the delivery of this mother. And at Yumbe Regional Referral Hospital, we have an ultrasound scan, which is dedicated for pregnant mothers, such that when they come, they are not delayed. Knowing very well that pregnancy is not a disease, it's a normal physiological process. So as a part of good quality care, when they come, they should not delay. Because pregnancy, as we said, is a normal thing. Just to add on is that another important component of the safe birth awareness campaign is quality intrapartum care and respectful maternity care. So intrapartum means that is care provided when a woman starts labor. And what should our women expect when they come to health facility? What they should expect is that the health worker will take history surrounding this pregnancy, starting from antenatal care. Antenatal care, when did you start? What tests were done? Did you fall sick during this period? Or do you have problems which occurred in the previous pregnancy and may occur during the next pregnancy? Things like, did you bleed during that time when you delivered? So it takes a detailed history, then the midwife or the doctor examines this mother to find out whether she will be able to deliver this baby successfully. Because the ultimate goal of antenatal care is to have safe delivery. If you provide antenatal care and the outcome is bad, then that is not quality what? Antenatal what? Care.
Okay.
So the other thing is that during labor,
Yeah.
or what we call during intrapartum, what happens is that there should be a skilled attendant.
Okay.
This skilled attendant ranges from a midwife to a doctor and to a specialized doctor, what we call obstetricians and gynecologists.
Okay.
And it should be the responsibility of each health worker who is in a maternity at least to be around when a woman is delivering.
Okay.
And ideally, we should have at least 2 skilled attendants. A skilled attendant means somebody who is able to provide successful delivery services, treat or manage problems which may occur during delivery,
Okay.
and then also find it out early, and then make an appropriate what? Referral to a higher. Manage it, that is, treat it, or if
Okay.
you're not able to treat, then refer the person at an early what stage. That is what we mean skilled birth attendant during delivery. And that is what we expect our women should what? Should get when they come to the health facility. And we are having this campaign in anticipation that we are going to have more of women coming to seek what? Health care.
Okay.
Then during intrapartum care, how do we ensure that this baby during labor is well
Okay.
up to the time of what? Delivery.
Okay.
So what we do is we normally monitor the baby's well-being,
Okay.
and we keep doing this. What we call what we use is what is called what? Patograph.
Okay.
And we give instructions to the mother. I've examined you.
Yeah.
Right now, we tell her about that the baby is either breathing well or not.
Okay.
Then we tell her that I'm going to examine you a certain duration of time. And then if something happens,
Yeah.
like if the water just bursts,
Yeah.
flows down,
Okay.
or if you start bleeding, or if you feel your baby is not turning well,
Yeah.
those are instructions we give them to come back for another check, because that is a sign that the baby is not what?
It's not
there is a problem coming up. So
Okay.
these are things which, when our pregnant women come to deliver,
Yeah.
they should be aware of,
Okay.
and they should also be able to ask our health workers about their baby, and we should be able to tell them exactly what is happening to their baby, and then how the labor is what?
It's
How the
progressing.
labor is progressing. So the whole campaign is all about sharing information between our clients who are the pregnant women, and then the health workers to be prepared in order to offer best service. Yes.
Before we go for the break, doctor, there is this trend of mothers doing exercises during pregnancy. We are in a world of, in TikTok, social media. There are mothers who are doing exercises. When should mothers do these exercises, and how vigorous should they be? What is your take on that? Does it affect the labor outcome? Is it encouraged? Is it discouraged?
Okay, thank you, moderator. The exercise we mean during antenatal care is a pregnant woman taking a walk.
Okay.
Not this physical exercise.
Okay.
Because strenuous exercise may lead to, the most feared complication will be the placenta may separate from the uterus before, and the mother will start what? Bleeding.
Okay.
So simple exercise like taking a walk
Okay.
is very healthy,
Okay.
but not the vigorous what? Exercise, because in early pregnancy it can lead to loss of the pregnancy.
Okay.
Then in late pregnancies, the placenta can separate and the baby may what? Die, and also the mother may have problems.
Okay.
Yes.
Yeah. Thank you so much, Dr. Inzama and Sister Susan, for the information you have given to the viewers. We are going for a short commercial break. Keep tuned to UBC TV. Be back soon.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back. This is the DOCtalk show. at UBC TV, brought to you by Ministry of Health with support from the government of Uganda. So, sister, we're still talking about these different components. So if a woman has finished giving birth, is there any special care that that woman is offered?
Thank you, moderator. Actually, this is a very important period where this woman is supposed to be monitored by a skilled person, especially the midwife. Until this this is both to those who deliver normally and to those who were also done cesarean section. So what they're supposed to do is every 15 minutes they have to check on this welfare of this mother and the baby. Then 30 minutes they have also to check. Then 6 hours. Then 24 hours. Because this woman can develop any complication like PPH, where it's a very common complication after birth. So the midwife has to be closer to this woman. Yeah. Then also during postpartum, there's also something that we need to really do. During antenatal, we counsel these people about family planning. If a mother has opted for any family planning, for example, intrauterine device, that is IUD, we can also insert the method for this woman, so that she will be able to protect this baby to two up to 3 years or 5 years when she is already using family planning. And it is for the well-being of the family, whereby you have a healthy baby, a healthy family, where you can take care of them, sending them to school, buying food, clothes, and any other things. And it is also advantage for the mother to also enjoying herself and also enjoying her marriage. Because frequent delivery really distort and disturb also marriages.
Yeah, thank you so much, sister. Dr. Inzama, is there any importance of referral? For example, a patient is being managed at a health center 2, a health center 3. When should that patient be referred? Can that patient also request to be referred by themselves, or it has to be an initiative that has to come from a health worker?
Okay, thank you, moderator. What I would like to mention is that, after taking care of the mother, you also have to take care of the baby, which includes administering tetracycline eye ointment, giving vitamin K, and then at the same time, the next day or immediately, she can also get some vaccines, that is BCG, which will protect the baby against tuberculosis, and then oral polio vaccine, which protects the baby against polio. So all the mothers should know the package the baby should get. Yes. And earlier we had said that deliveries can occur from lower level to the higher level, and there are situations where a health center 3 cannot manage a pregnant woman. There they will need what we call quality referral. Make a call to the next referral center, then administer what we call pre-referral treatment, like giving IV fluids, giving antibiotics, in anticipation that when they reach there, they will not repeat the same type of medications. Have an available transport means, and then also during antenatal, these mothers should be prepared, because if they are referred at a higher center, they are not in their local communities. Then after referral, there is need for feedback. That is feedback to the referral facility, telling them about this is what happened, this is the outcome, such that next time you appraise them. That is thanking them for what they have done, which is good. Then if there is something, if there is a delay, you also give them feedback such that next time they will improve. That is what we call, it is like a feedback mechanism where the end user should get the results and then share it back with the referral facility. And in Uganda, we have what we call the emergency referral system, where each regional referral hospital is tasked to manage referral system from the lower levels to the what?
The
highest
highest
what?
level possible.
Level.
Okay.
Than using free fuel
Yeah.
for all the emergency what? Referrals, which is a very important step in terms of offering quality antenatal, quality maternal child health care what? Services.
Okay.
Yes.
Yeah, thank you so much, Dr. Inzama, for taking us through the different components of the birth awareness campaign. Maybe as we conclude this session, is there any take-home message, Sister, you'd like to give to the viewers of UBC TV and maybe the closure?
Thank you so much, moderator. It has been a really participative debate. The message that I have for my viewers, especially my people of Yumbe, you know, safe birth awareness is very key. And since Yumbe, which has a lot of teenage pregnancy, so I encourage these young girls to come and attend antenatal clinic early, so that
UBC, inspiring Uganda.
Once again, News Tonight at 10. We're here to bring you It's Making Headlines. My name is Patricia Lukomampango. Before we head into the bulletin, let's look at the top stories.
Brought to you by Uniquely Ours. Explore Uganda.
President Museveni receives 20,000 new converts to NRM. Prime Minister Nabanja inspects Mukono Hospital, pledges to rectify congestion issues. Public Service Commission recruitment exercise fortified with digital safeguards. MTN Momo makes transactions across borders seamless.
Brought to you by Uniquely Ours. Explore Uganda.